My name is Paul Quinn. I'm the Director of Nurse Research, and I was the co-chair of the LGBTQ Steering Committee at the Valley Hospital.
My name is Pam Bell. I'm the Patient Experience Officer for Valley Health System, and I served with Paul in our first LGBTQ Steering Team Committee. And we're here today to answer some questions from our community about serving the LGBTQ population and the Healthcare Equality Index. So Paul, our first question from the community is, my partner and I are thinking about starting a family. What services does Valley have that would help us?
Valley has great OBGYN services here, and they're welcoming and affirming and inclusive office practices. From there, we also have reproductive endocrinology or the infertility center that can help couples with a wide range of problems or unique situations. We have a fantastic labor and delivery unit, a level 3 NICU, and then afterwards we have a great pediatric unit. We have all services to support a family.
And we've had many same-sex couples use our services, correct?
We absolutely have. They've had a great experience with us.
Great.
Pam, this question says, I saw a banner in the lobby that said Valley is proud to be a leader in respectfully caring for all of our community, and then had the LGBTQ healthcare equality listed. What does that mean?
So back in 2016, Paul and I chaired a committee that looked at how we could be recognized as a Healthcare Equality Index leader. There were about 4 different chapters with many standards that had to be met, from human resources and how we treated our employees, different types of processes that we had to change for our healthcare benefits for our employees. We had to do communication, not only with our own employees, but education. So what I would say that means is that Valley has met a robust standard process to make us an LGBTQ-friendly healthcare system, and that we want to promote that and know that all of the LGBTQ community members that need health care, their needs can be met here at Valley.
And to recognize that those measures are equal to or have not surpassed other hospitals that have the same designation. I think it opens a lot of doors for us.
Yeah. So Paul, what do you think was the most challenging piece of that application and required the most change from us in terms of our current operations?
You know, Pam, I think the most challenging part of that application was getting everybody onto the same page, bringing us from different departments and different facets of the organization into one focus, but that was actually our most uniting. And I think it drove us forward and kept us focused now as patient care services, as information systems, as human resources, to bring us all together under one topic of addressing the needs for the LGBTQ community.
Yeah. It's true, and you know, I think we learned a lot too, especially early on. There was so much that we didn't know about the LGBTQ healthcare needs, and like we were learning, and the committee was learning, and then we helped the organization learn. So I really think it made us stronger too.
Right. So the next question, what does Valley's HEI mean for me and my partner?
You know, Paul, that's a really good question and a very important question, because what it means is that we're a safe environment, that we've educated our employees, that we're going to treat you with respect, that we're going to honor your choices, and that you're going to have a good healthcare experience with us.
And it's probably important to remember too that whatever office, hospital, facility they go in related to Valley, it's going to be welcoming, inclusive, and affirmative.
Yeah. So Paul, our next question is, what is Valley's next step to continue to grow and ensure equal rights?
So Valley's been very active in addressing needs of social equality, things that impact not only the LGBTQ community, but our community at large. And staying focused on changes in technology, staying focused on changes in science, and changing focus on what's happening in our community. They stay focused on making sure that they are in touch with the community at all times and ready to meet their needs.
And we started the Social Equality Council as well this year that looks at a broader perspective of equal rights for our employees and the community that we serve. So I would say we're really progressive in that regard.
Absolutely. Pam, the next question. Valley sounds like a great organization to work for, especially for the LGBTQ community. Are you hiring?
Yes, we certainly are. We have a website. We have different positions open across the whole system, and we're very committed to developing and creating and sustaining a very diverse and inclusive workforce. So we'd love to see you with us.
Pam, our next question asks, what has Valley done to support the LGBTQ community overall?
So we've built alliances with state organizations. We've sponsored like the New Jersey Equality Ball. We've participated in the Pride event over in Maplewood. We've had education where we've had leaders from the community come and talk to us about their experiences as a transgender patient.
I think we've also increased our public recognition of the community. We hosted our annual flag raising, which has now become an annual event at the hospital, where our leadership team and our own CEO raises the flag proudly on the first day of June.
Yeah, I think building alliances with the community has been really important.
Thank you for joining us today. We're here for you when you need us.